My name is Deanna Hayes, and I'm here to share with you the importance of becoming an organ donor. I hope after you hear this speech that you will see the importance of being an organ donor and go get registered today. First, I would like to start by sharing a passage with you. After contracting a mild case of the flu, doctors told 21-year-old Lisa that her heart would last her no more than 3 months. Her only hope was to get a new heart. A month later, 20-year-old Sally was in an automobile accident and suffered from severe head injuries and died. Her heart could have saved Lisa's life. When Sally's parents were asked if they would allow their daughter's heart to be donated, however, their hysteria and grief over just losing their young child was too great. They refused to donate Sally's heart, and less than a month later, Lisa died. Now I ask, think about how you are feeling. Think about how Lisa might have felt. Still not convinced? Just wait. Did you know that every 13 minutes someone in the United States is added to the national organ list that is already more than 96,000 people? More than 12,700 people wait 5 years or more to get a matching organ because there are not enough organ donors. Every day in the United States, 17 people die waiting for an organ. You might not say that's a lot, but in an average man's lifetime, that totals to about 2 million people that will die from not having a transplant. But have no fear. There are ways that you and others can help. How? By becoming an organ donor. How to become an organ donor? All you have to do is get in touch with your local doctor, and they will tell you all you need to know. You fill out one form and receive a card. It's really that easy. Then once you have passed away in many years to come, your organs will be removed and will be given to someone else for the chance of life. Who can become an organ donor? People of all ages and ethnicities should consider themselves potential organ donors. There are few exclusions and no strict upper or lower age limits. Potential donors will be evaluated for suitability when the occasions arise. No one is too old or too young. Both newborns and senior citizens have been donors. The conditions of your organs are more important than age. Someone 35 years old with a history of alcohol abuse may have a liver that is in worse condition than someone 60 years old who has never consumed alcohol. In addition, people on the waiting list might need a transplant with an organ that is less ideal if there are no other suitable organs available at the time to save their lives. Doctors will examine the organs and determine whether they are suitable for donation if the situation arises. If you are under 18, you will need the permission of your parents or guardians to donate. What can be donated? Organ donations can occur with deceased or living donors. Deceased donors can give kidneys, pancreas, livers, lungs, hearts, and intestinal organs. A living donor can give a kidney or a portion of the liver, lungs, intestines, or pancreas. Tissue donations. Donated tissues such as skin, bone, and heart valves can dramatically improve the quality of life for recipients and even save lives. Most tissues are donated after death by people who have previously committed to donations. Unlike organs, tissues can be donated up to 24 hours after a person's heart has stopped beating. Some frequently asked questions. Does it hurt to donate? All surgeries cause some pain while you recover. The amount of pain depends on the type of operation you have. Your transplant team will make sure that you have the least amount of pain and discomfort. Most donors feel that the pain is worth it because you have helped someone live a longer, healthier life. What are the risks? Before you donate an organ, the transplant team will assess your risks. They will explain all the risks and benefits of being an organ donor. They will tell you what choices you have, and you decide if you want to donate. They will always be there for questions. Can you get paid for donating an organ? No, it is against the law to get any money or gifts for being an organ donor. Are there any costs I have to pay for? You do not have to pay for any of the tests or for seeing a doctor. You do not have to pay for a hospital costs. However, you are responsible for the cost of your own health after the organ donation. How long does it take to recover? Most donors feel good within 60 days after surgery. The actual time depends on the type of operation that you have. Are there any long-term effects to surgery? Any surgery can affect your health over time. However, donating an organ does not usually cause long-term health problems. Your transplant team will discuss the potential risks with you. If you are having problems as a result of your surgery, call your transplant program. In general, however, transplant centers do not give long-term health care to donors. In conclusion, I hope that I have shown you that the gift of life is the most important gift anybody can give. How I see things and what has changed my perspective about becoming an organ donor is that after I'm gone, I will have no use for my organs. So why should I deprive someone else from using them? Please consider what I have to say. Thank you.